I want to talk quickly about government or subsidized healthcare. If you're in the United States and you have health insurance, it's likely through your employer, you pay for it yourself, or you have some through some governmental agency that either removes or reduces the price, such as Medicare, Medicaid, or insurance through the Affordable Care Act. And health insurance is extremely expensive. And to go to a doctor to get any procedure or whatever, people go bankrupt over this stuff, or they just don't pay for it at all. And unfortunately, their life is significantly impacted by it or ends. Even like life sustaining insulin is not affordable. So there's the discussion of other countries have this subsidized healthcare where the government pays for it. Why don't we have that? And then what always gets brought up is like, if you ever have to go to a specialist, you will probably not make it to see that specialist, especially if it's something like cancer that could take months and months to get into. So if you know more about this, if you actually live in one of those countries or have studied this, I would love to hear your thoughts, but kind of got to thinking about it and I was like, why does it take so long to get in to see these specialists? And one reason I can think is that, is it because people can actually go? Where in America, if you don't have the right type of insurance or you don't have the right type of coverage, there's also in-network, out-of-network, specialist, tier one, all these other things. So like, are some of these people just not going because they can't? And if you live in a country where you don't have to pay for it and people need those services that they can, which then unfortunately makes a really long list until you can go in to see the doctor. And when you think about it that way, you think about, well, if I got cancer, I could go in and see a doctor in a week because I'm privileged enough to have health insurance that would cover it. But there are those people that do not and cannot. And so I am able to get a spot because someone else cannot. I'm sure there's other reasons, governmental red tape. I don't know if there's less doctors because it doesn't pay as well. Again, if you're an expert on this or you have any other thoughts or ideas, I would love to hear it from you. I have to believe that adds to part of it. And just really sad when you think about it that way, that like some people are getting treated because others literally can't.